Thank you all for joining us. We're going to get started in a few minutes. Okay, welcome and welcome all. Hi, my name is Nataki Duncan, and on behalf of the School-Based Health Alliance, we would like to thank everyone for attending today's webinar titled Strategies for Solving School Oral Health Consent Challenges. During today's presentation, we will learn and discuss key tips, tools, and strategies on a range of oral health issues from school oral health programs across the country. But before we begin, we have a few housekeeping reminders. So first, please help us with our attendance count. If you are viewing as a group, please go to the chat window in the chat icon, type in the name of the person registered and the total number of additional people in the room. For example, Tammy Jones +3. This will help us with our final attendance count. Also, all attendees are in listen-only mode. However, we want to hear your questions. So to ask a question at any point during the webinar, please use the Q&A icon located in your Zoom toolbar, either at the top or the bottom of your screen, and we will address questions following the presentation. At the end of this webinar, attendees will be asked to complete an evaluation poll questions. So please let us know how we are doing. Your feedback is vital in helping us craft presentations that meet your needs. This webinar is being recorded and will be archived on our website in 3 to 5 business days. Please also visit the School-Based Health Alliance website for additional archived webinars for topics such as the ones you are viewing on your screen. The School-Based Health Alliance works to improve the health of children and youth by advancing and advocating for school-based health care. When health and education come together, great things happen. Attendance improves. Conditions like asthma or diabetes are better managed. Behavioral issues get quick expert attention, and we all know that healthy students make better learners. But one thing that we're focusing on today at school is oral health in schools. So I will pass it on to Tammy Alexander.
Hi, everyone. Thank you so much for joining us today. I'm the Senior Program Manager of the School-Based Oral Health Initiative, and I just want to sort of set the stage or the background for our webinar today. So the presenters are part of our School-Based Oral Health Services Initiative, and that initiative is supported through the grant from the DentaQuest Foundation. And we are part of the Foundation's Oral Health 2020 goals, and of the 7 goals, ours is focusing on incorporating oral health into the primary education system. So this slide represents how we're going to try to achieve finding out the best ways, best practices of getting oral health services into the schools. So we are working with 7 of the largest school districts currently in the United States, plus a few additionals who have joined our effort. And we're working in a learning community model. We're working to identify what's going on at the district level, what's working well, what may not be working so well, and we're trying to find those innovations that will improve and ultimately reach more students with appropriate oral health services. So this slide, it's very dense, and you can look at it later on, but it basically shows our goal on the left, and in the middle, and going right, it shows the primary and secondary drivers of change that we're going to utilize to try to increase and improve the oral health services in the school. So I'm going to turn it back to Nataki. I know it's very brief, but for more information on this, our school oral health program, you can go to our website afterwards, and we'll also be, these slides could be available if you need them, or you can, hear the archive webinar again. But I'm going to let Nataki introduce our presenters who represent our learning community.
Thank you, Tammy. Now, we have a great group of presenters today for you all, so I would like to introduce them to you. We have Kimberly Bartolomucci. Kimberly Bartolomucci has been with the Oral Health Forum, formerly known as the Chicago Community Oral Health Forum, for 9 years. She began her work at the forum as a coordinator and is now the program manager for education and community initiatives. Kim has worked in the dental field for over 30 years. Early in her career, Kim worked in a private practice and realized that she would prefer to work in systems change projects to help all people access oral health, especially the underserved population. Kim and the Oral Health Forum has built strong coalition of stakeholders in awareness of oral health, which was brought to the forefront of the health issues in Chicago. Mary Pat Burgess. Mary Pat Burgess has been a visionary and enthusiastic leader in dental hygiene and community oral health. Her passion for improving access to care has been a defining element of her dental hygiene career, propelling her from a small-town private practice to the Chicago Public Health Department. Her successful career transition has been an inspiration and role model for other dental hygienists seeking to do the same. In her role as the first oral health program director for the Chicago Public Health Department, she successfully created Chicago's first school-based oral health program, the largest oral health program in the U.S. In her 17-year career in public health, she has developed the first oral health program in the 3rd largest city in the U.S. Because of her work, the children of Chicago now have better oral health and better lives. Catherine Stafford Hudson. Catherine Stafford Hudson is a program manager for Chicago Public Schools and currently oversees the vision exam and dental exam program for the district. With over 20 years of experience shaping innovative and creative programs that positively impact children, families, and communities, Mrs. Hudson has a variety of program development experiences and in both the public and private arenas. Mrs. Hudson has worked for a CPS for 8 years. Her responsibilities includes developing trainings for school staff on vision and dental service coordination, developing a vision referral process, encouraging improvement in clinic operations, managing the vision and dental team, and strengthening relationships with community partners to improve delivery of vision and dental services. And last but not least, Ms. Georgia Famuliner. Georgia Famuliner serves as Operations Director for Smiles for a Lifetime, a school-based program that provides preventative and restorative dental services to limited income children in 4 rural school districts in South Carolina. The school-based sites are located in Allendale, Dillon 4, Clarendon 1, and Clarendon 2 school districts. SMILES is an outreach program of Vista, a statewide nonprofit that provides prescription medication for the uninsured in South Carolina. Prior to this position, Georgia worked at Allendale County Hospital for 9 years as a registered nurse, serving the last 3 years as Director of Nursing. Mrs. Famuliner is a graduate of the University of South Carolina. Thank you, everyone, and I will now turn it over to our first presenter, Mrs. Georgia Famuliner.
Thank you, Nataki, for that. I just want to welcome everyone, and I'm very excited to be here today, and I hope to share with you some very innovative ideas to help you capture patient consents in your programs. This first slide, I represent an organization, like Nataki said, in South Carolina called SMILES for a Lifetime. We're a school-based dental program. Next slide, please. We're owned by the nonprofit Vista, which is based out of Columbia, South Carolina. The SMILES program started in 2001, so we are presently in our 16th year of operation. Next slide. The mission of Vista is to provide access to medications and limited pediatric dental services to the underserved of South Carolina. Next slide. The program SMILES for a Lifetime is presently in 5 districts. We just opened a 5th district 2 weeks ago in Hampton County, and we're presently serving 26 schools, and we see kids in K3 through 12th grade, and we do preventive and restorative services. We have about 20 dentists that own their own practices but drive into these areas a day a week or a day a month to come and help the children in this program. Next slide. So we are in Allendale, Dillon, Clarendon 1, Clarendon 2, and in Hampton school districts. And the total number of students enrolled last year in these districts was around 8,300 students. Next slide. What makes us unique is that we are running a rural program. All of the areas that we're in are poverty-stricken. There's very limited industry in these communities, so the jobs can be anything from getting on a bus and driving 2 hours to Hilton Head from Allendale to work in food service or in industries like cleaning hotels. There's just no industry in these small areas, which makes our unemployment rates very high, and there's low population in these areas. Next slide. We operate very much like a regular dental office in that we're doing preventive and restorative services. These are some of the services. Also, we do pulpotomy, stainless steel crowns. We do not do root canals, but send those out and refer those to other dentists when we can get the parents and transportation organized. That's one of the real problems in our area is transportation for parents. So the SMILES program is very successful because we have a driver and a car. We're based on school campuses, and we pick up the children from school, bring them back to the center, clean their teeth or fill whatever we're doing for the day, and then take them immediately back to school. So there's very small amount of class time lost during the day. Next slide. Just some of our staff. Next slide, please. So one of the things that's been wonderful about helping in the with the School-Based Health Alliance is the fact that we have been getting ourselves just ways that we can think outside of the box, be very innovative. And one of the things is on the first day of school, we blanket the schools with consent. So every single child gets a consent. And then within 6 weeks, we are sending those back to school again, because we've recognized early on that if you're not constantly sending the consents home, then whatever you send at that first initial part when school starts kind of gets stagnant and you don't get any more. So 6 weeks later, we developed a sticker. It's a 3-inch by 3-inch sticker, and it's got SMILES for a Lifetime and Sign Me Up. So the idea is 6 weeks after school starts, we get a roster from the schools. Any child we've not seen a consent on so far, we write their names on the consent, send it back to school with a Sign Me Up sticker, and they wear that home on their shirt so that when they go home in the afternoon, the parent will see that sticker. It's a visual reminder for that parent to sign that child up. They may think, oh, I got that consent 6 weeks ago, I lost it, I didn't return it to school, but now they have another consent. So that's been one of the ways that it's been a great tool for us. We've been using it for about a year, and it's been very good for the children to wear that home and get that parent to fill out that second consent. Next slide, please. The next one is actually, I'm sure, something Mary Pat Burgess will count on, but I want to give her the big kudos today. This was an idea that came from her group with the Chicago Public Health, and one of the wonderful things about the initiative is that we all share ideas with each other and come up with ways that we can garner more consent. So this is a bracelet idea. It's a paper bracelet that is much like those that you get at the fair. So 6 to 8 weeks after the initial run that we send home, at the 12-week mark, we're sending something else home. So this time it will be bracelets. Any child we have not gotten a consent on, that consent name will be written on there, sent back to school, and they'll get a bracelet that they'll wear home that day. The visual color, very bright lime green, and I think the consistency really counts. Every 6 to 8 weeks, we are sending something home with the parent with the consents for children that have not signed up yet. Next consent. This is a parental consent that's been great for us. It's a flyer that we had actually printed at a printer, but you could certainly do it in your own offices on a copy and just fold it. But it's basically a very quick question and answer that just tells the parent who can come to Smiles, how do I sign up, where are the centers located, does the parent have to pay anything, what care is my child going to get, who is actually going to treat my child, and why should I even come to Smiles. This is given out by our outreach workers and our staff at community events such as health fairs. We go to teacher meet and greet nights, PTO meetings. Some of the sheriff's departments in these rural towns will have back to school events. So it's been a great way. Some of the schools keep them in the offices so that they can pass out information to parents come in, just to let them know what is available in the communities in the school districts. Next slide. So another big idea that was great for us last year, we started a teacher incentive program. We thought, what can we do to get more interest from the staff of the schools, principals, teachers, whatnot, to know about Smiles? And so we decided that we would go in, send a flyer to the teachers, and when those consents go home on the first day of school, the first 4 teachers in the homerooms, the first 4 homeroom teachers that get 100% of their consent returns wins a $50 gift card. We did not know how this would go over, but it was a very successful, even on the first year trial last year. We don't tell the parents they have to let their child come to Smiles. They just have to send that consent back to school. So we'll get a few flyers that will or consents that will actually say, my child's going to another dentist, or one may be written on the top, my child, I don't want them to come to Smiles for whatever reason. But there's not many that come back that way. Most of the consents that come back are parents that are allowing us to see their child. And all the teacher has to do is every day just remind that child, you know, the first day of school, we send home a form. The next morning, ask them who had it filled out and hand it in to their teacher. The second day, remind them to go home and get it filled out. So all the teacher has to do is give a reminder every day verbally to the child, take up the consents. How easy is that? And they win a $50 gift card. So this school year alone, we've been in school since late August. We have already had 20 teachers win in the Dillon School District, and overall we've given away 30 cards so far. So, and it's been a great, and most of those consents are parents that want their children to be seen by Smiles. Next slide. One thing that is new for us that we're trying to work on is we're going to put together a student ambassador program. The School-Based Health Alliance learning community, as we've all spoken over the last year, one of the areas that we had the hardest time getting consents is high school students. You know, we think as adults that maybe we understand what the problems are. Maybe a child doesn't like injections. Maybe a child is being teased by someone at school because they know they're going to the dentist. But we want to take this back and try to develop a focus group, which is going to be comprised of about 10 students, 10 to 12 students. We're getting the guidance counselor and school nurses at the high schools to help us with this. And they're going to choose 10 or 12 students that are leaders in their school. These can be children that are in Beta Club, National Honor Society, football captains. But we also want students that are good students that maybe are already coming to Smiles, that are maybe more on the quiet side, don't get involved a lot in school, but can be someone that could be peer-to-peer to share information on oral health. So in the next couple of weeks, we've got meetings set up to meet with that guidance counselor and the students and the school nurse and talk about doing a survey in about a month. It's going to be a one-page survey with about 10 questions. Most of the questions will be yes or no. There'll be things like, do you go to the dentist every 6 months? Do you think it's important to go to the dentist every 6 months? And then there'll be a question that they can fill in the blank of why would they not want to go to the dentist. So we're going to get with these students from the high school, help them develop some additional questions for the survey, and then those 10 or 12 students will actually do this one day. It'll be a one-day event where they will go into the 2 or 3 lunch periods that they have at high school, and they will actually go around with a clipboard and have the students fill these in as they eat lunch. It'll be a quick process. We hope to do a consent a minute. The students that are willing to fill out the consent will be given, or the survey, will be given a bright lime green bracelet. These will be those rubberized bracelets that you can have things engraved. We've got our logo with Smiles for a Lifetime on it, and that will be the incentive. The child will get a bracelet when they fill out the quick survey. And then those 10 or 12 students that are going to be part of this focus group will actually receive a certificate from us, which they can use when they go to register for college and do their resumes. It will look good that they've done some community service and stuff for the Smiles program for their school. And also we're going to do a pizza party to celebrate their willingness to help us. And through this focus group, we hope to get a peer-to-peer review of why students that grade level in 9th through 12th grade would not want to go and have any type of oral health service done, why they would not want to go to the dentist, and we can get feedback from that to help us figure out what we can do to excite that age student to come and get their parents to sign consents. Next slide. So a large part of our program in the last year has been outreach. We hired outreach workers, one at every school that we have. And the role of that person is to attend PTO meetings, go to open house, anything in the community, meet and greet the teachers, school events. We have some pop-ups made. That's what's on this slide. They're really great posters that are very easy to assemble. They're about 8 feet tall, and so it really shows when people walk in the door who you are, what your organization name is. Those outreach workers work in our offices to actually call children that maybe we've had consents on in the past, but for whatever reason they haven't signed up this school year. They offer to meet people around town. We want them to be in a safe environment, so we don't ask an outreach worker to go to anyone's home, but if they can meet someone at a library or a fast food restaurant or somewhere around town, a bank, parking lot, somewhere, because some of these people don't have transportation in these rural areas, and so it's very important that if the parent doesn't send that consent back in the book bag, or the child chooses not to give it to their teacher, that we have some means that our outreach worker can connect with that parent to get consent signed. Also, if we can get a good working active address, we offer to mail it to their home with a stamped self-addressed envelope so the parent can easily return it to us. Another idea that the outreach is working on right now is having a minister's breakfast. All of the rural communities have lots of churches. Allendale alone is a county with about 11,000 people, but there's 60 rural churches in this community. So all of the areas that we're in have large volumes of churches. Some of them are very small, but we figured trying to get the ministers involved to share information about the program, they can go back, excite their congregations, and hopefully those people in the church along with church leaders, will encourage parents to sign children's consent forms. Next slide. These are a few successes and challenges that we've had with the program. Obviously, one of our great successes are the number of children that we've been able to serve over 16 years. To date, we've seen over 15,000 children and have provided over 90,000 restorative procedures. So we're very excited about the number of children that we've served. These children have improved oral hygiene to the point that many of them come back and have reduced, if no cavities, after years of coming here to the Smiles program. It's also allowed us to develop an excellent relationship with schools so that the superintendents, the principals, the secretaries, people at the schools and the teachers really get to know who Smiles is, and they just welcome us into the schools to come and take care of these children as we transport them. We are housed on a campus somewhere in the areas we serve, but that car and driver picks them up from class and then immediately brings them back. The challenges for us have been the number of consents we've obtained. Even though we're proud of the number of children we've seen, last year in these districts, they had a total of about 8,300 children, and we served 3,800 last year. So there are many more children that we're not touching that we are just trying our best ways of being innovative and grasping at ideas that we can interest parents in signing consents and to understand the importance of coming to the dentist. Another challenge for us is operational funding. Being a nonprofit, the SMILES program operates predominantly off of Medicaid reimbursement. That is really tough because the amount of funds that we get from Medicaid, the amounts are lower. We have a hard time getting grants. We can find grants that will do things like update your equipment, but we can't find grants that do day-to-day operational expenses. So that makes it very tough for us from a funding standpoint. Another challenge area for us is high school students. I touched on that earlier with the program we're starting with, that ambassador program. We really want to reach out. That is the one grade level, 9th through 12th, that we have the least amount of children that we see. So we look at that as a real challenge. And then obviously just the lack of oral health education in the community. In those 5 centers that we're in, we come off on a lot of times with high schoolers that maybe will be coming to us for the first time that have to have molars extracted because the decay is too far gone for root canals or crowns. And at that point, sometimes when we're talking to parents about having to do extractions of those permanent teeth, they'll say, I've lost teeth and it's okay, the child will be okay. So we're trying to change that mindset as the outreach workers and our staff go into community events. We're just, giving a lot of oral health education out, talking to parents to make them realize that it's really not okay to lose teeth, that it's not okay not to go to the dentist, and to share that information with as many people as we can touch. Next slide, please. So at this point, I just want to thank everyone for taking the time out of your day to join us, and I hope that you've taken away some great ideas for me, something that I've been able to share that will touch your program. And thanks for attending, and we'll go back to Kentucky.
Thank you, Georgia, for that insightful presentation of your school-based oral health program. I know that it's tough to reach out to those in the rural communities. So now we're going to go to a different setting in a more urban area in Chicago to Mary Pat, Catherine, and Kim.
Good afternoon. This is Catherine Stafford Hudson. How are you? We are going to talk about, the name of our PowerPoint presentation is Increase Access to Oral Health Care for Chicago Public School Children. My partners are Mary Pat from the Chicago Department of Health, myself from Chicago Public Schools, and Kim from the Oral Health Forum. Just a little bit about our different groups. Mary Pat is from the Chicago Department of Health, the Adolescent and School Health Department. She started the program way back in 2000 with 3 schools, and now we have over 400 schools participating in the process, in the program. I'm from Chicago Public Schools, from the Office of Student Health and Wellness, and we work very closely with the Chicago Department of Health on a couple of other health programs, the dental oral health program, as well as the vision program and our sexual health program. And then there is Kim, who works very closely with both the schools and the Chicago Department of Health, and she does a lot around education and case management. And she's seen over, in the education, she's seen over 25,000 students. Next slide. So this is just a snapshot of the demographics of Chicago Public Schools. Basically, we have over 300,000 students, pretty close to 400,000 students in approximately 652 schools. So we're the 3rd largest school district. Our economically disadvantaged numbers at about 77%. Our Medicaid, or students who are enrolled in Medicaid, is about 60 to 70%, which is really important because our oral health program actually is funded through charging our students who have Medicaid. And so when our percentage falls below a certain percentage, then it puts our program in jeopardy. Next slide. So over the course of years, if you look at the numbers, which is extraordinary, and honestly, I've only been with the program for a little bit over a year. So Mary Pat is the oral health guru who started it and expanded it. But looking at the numbers, I think around 2012-13 was our largest number of students that actually went through the program. And right now we're experiencing a decrease. And basically there are a couple of different reasons why this is happening. One is the district in itself loses about 5,000 students a year. So they move out or they don't attend Chicago Public Schools anymore. Last year, 2016, we lost 8,000. And then last year, 2017, we've lost about 10,000. So as you can see, there's just less and less students to participate in the program. The other thing is the way CPS used to distribute our consent forms. They used to go home with the free and reduced lunch packet, and we no longer have a hard copy that goes home with parents. So the consent form does not reach every student, and usually we would get a lot of those back because they went home with the free and reduced lunch packet, and that doesn't happen anymore. The other thing is there has been a change in the billing system or cycle for the state of Illinois, which makes it more difficult. So originally, in past years, the school-based program was really protected by being able to use a different code in billing that did not interfere with their home site visits. And now there's just one system of coding, which again, now we have, dental homes that are competing for our kids. So that kind of explains our decrease. But the good news is that in 2016 and 17, since the inception of the program, over 1 million students have participated in the oral health program. Next slide, please. Okay, so this is looking at our totals from last year. There were a number of students seen was over 89,000 students, and we do see pre-K through 12th grade. So that's 24% of the CPS school of students that participated in the program. Amazing. We saw about 475 schools participated, which is about 73% of CPS schools. And the number of referrals. So we call them 2s and 3s. 24,000 students had a referral. What we call 2s are, correct me if I'm wrong, Mary Pat, but the students who have 4 or less cavities. And then the referrals for 3s are like almost 6,000. Those are students who have 5 or more cavities. And basically, in the oral health program, we do exams, cleaning, fluoride treatment, sealants if needed. We also refer for follow-up care. We do quality assurance as well as case management. Next slide. I'm going to hand this over to Kim, who will explain more.
Thank you, Catherine. This is an infographic that we developed to explain the program. It was first started with the Mary Pat's program for the screening and the prevention portion. She started, like Catherine said, back in 2000, where the children are seen for preventative services. We started the oral health education back in 2012. We started after Mary Pat's program seemed a little bit of a decrease in numbers of consents, where we hosted focus groups for the parents of the schools and also the administration to see what they else needed to be part of this program. And one of the things that we heard over and over was they wanted the oral health education back in the schools like when they were small. So we developed a program and a curriculum, and it went through the Health and Wellness Curriculum Review Board. And it's the only curriculum at CPS that has been approved by the Health and Wellness Office. This graphic also shows then after Mary Pat's program, where her providers inform parents and caregivers with 2 phone calls and a letter home. We also started a case management pilot, and we work in 3 zip codes and are expanding to a 4th this year. This is a more intense case management program where the children are seen by the school sealant program, and if they have a 2 or 3, They are followed up with phone calls until they reach the parent, and letters. And then we also do parent meetings in the school. We meet with the administration, and if their parents are still having problems, bringing them to a provider, we bring in that could do restorative to the schools. So it's a very comprehensive program in Chicago. So you have your education, your screening, and your case management. Next slide. Okay, so the Oral Health Forum, the oral health education portion of it is in conjunction with the School Dental Sealant Program. As part of, like I said, the comprehensive program, we deliver oral health education to each classroom, to the schools that will allow us in. We do 25 minutes per classroom. We teach them all the topics such as proper brushing, flossing techniques, poor nutrition choices, along with the smart choices for nutrition, the importance of going to the dentist twice a year. And as the children increase with age, we introduce new topics such as mouth guards for sports for 5th and 6th graders, the dangers of smoking and tobacco products for high school students. We talk about how HPV virus is spread and what it is. We also talk about dangers of drug use. We send each child home with toothbrush, toothpaste, floss, a brochure, and sugar-free gum. Our funder is Wrigley, so we get the gum from them. Outreach materials for parents. We started doing this a couple of years ago to where CPS have parent groups for each school. And we go to the school while they're having parent groups, they invite us as a speaker, and we speak to the importance of good oral health. So we're reinforcing what the children are learning in school back to the parents. We also give them the incentives, toothbrush, toothpaste, and brochures, and we usually serve them breakfast at their meetings. We go to back to school events. We also go to report card pickups. We do health fairs, and in the summertime, we go to the Chicago Department park districts. And a lot of the same students who've heard the message in school is being reinforced in the park districts. Okay, next slide. All right, as you see, in 2012, spring, we've seen 2,000 in our pilot, and that was only 3 schools. But then in the school year, 2012-13, when we started, we've seen an increase every year, except last year we went down a little. Next slide. School-based oral health case management. This is something new that we introduced to the program 2 years ago. And the Oral Health Forum started working with Mary Pat's program to find better ways to make sure that the children are having the follow-up care that they need. So we hired case managers to do follow-up calls. They meet with parents at the school. They are giving list of providers in the area. They also are sent home with supplies, and then if still they have no luck getting their child there, whether it is due to they can't take off work, no transportation, that we will bring the dental van to them. This past couple of years, we've been working in areas that have high undocumented immigrants. So a lot of the low consent rates are also due to they are afraid to sign up for anything. So that's part of our education program and our case management program to educate the parents that this program is safe, their children are safe to sign up, and that they're going to be seen by the dental professionals. Okay, next slide. And Mary Pat.
Thank you very much, Kim. I'm going to assume that I can be heard. I was having some technical difficulties earlier. The program, this is kind of the fun part. we started a pilot program in 2016-17 to see if we could increase dental consent. And what we ended up doing is we had linkages to the schools, and the idea was to have the dentist notify the schools that they were coming 2 weeks prior, working with Kim's program to do oral health education, which would then provide consent forms. We also did robocalls just prior to when the consent forms went out, so that the parents would know that the dentist is coming and that the child is coming home with something. And the wristbands, and we had posters. Next slide, please. This is a picture of the posters and the wristbands. This is for school kids between the ages of pre-K to about 6th grade. A little bit after that, 7th and 8th graders, the wristbands get to be a little bit lame because they're just kind of not quite as cool as they probably should be. But we did notice that when we did this program in our pilot schools that we had an increase of consent returns between 22 and 48%, above and beyond what was received from the schools, the doctors, from the initial consent distribution when the school started. So we've kind of rolled it out to all the providers this year, and the CDPH was able to supply posters for everyone, and I don't know, close to 2,000 wristbands due to a grant that I have with the CMET program. And the doctors are going out. What we're asking them to do is when they re-paper the schools to increase the consent forms after the education on this pilot, to use the new consent forms that we gave them are green to match the wristband. So that we'll be able to tell and have some delineation about how effective the second approach was, because they would be able to know that there were difference between the original consent forms, which are white, and now the second form, which would be green. As those are running out from what we delivered, we're asking them that if they end up reprinting more forms because they're just doing a lovely job and everything's working well, to make it any color with white so we can continue to do the differentiation and tabulation at the end of the school year to see how effective the poster and wristband for the smaller grades, grade school kids, how effective it was. Next slide. So when we talked about, we were approached by an organization called Vista Challenge, a national organization. It's been in Illinois for quite some time, and from what we're understanding now, it's also involved in schools in Washington, D.C. and Los Angeles. It's a high school student involvement program where students pick areas of interest of their peers and then do promotion programs in a specific year. And this year we got really lucky. They chose oral health. In the past, they've used condom distribution, STI education, teen pregnancy information, that kind of thing, with the concept that they have every school that has a mikvah student in the school is their health champion on some levels. So what we went with was posters and wristbands, and they're different from the ones that you just saw. They're more adult. The students actually created the posters which made them very eye-appealing to their peers. And we aren't using the paper wristbands this time, we're using the dummy wristbands. And we ended up with 3 slogans that we're going to have printed. And one of them is, "You can't be on fleek with yellow teeth." The other one is, "Get rid of decay, brush your teeth that way." And the third one is, "Don't get played, brush." These have resonance to the students. These we're hoping will be a talking point. When Kim is going to be coordinating education with the schools, we're hopefully going to get this started by the end of November, early December. We're also involving ourselves with social media. We're going to provide information, infographics on Twitter and Facebook and Snapchat. And we're developing links that will be available so that The students or parents can link into either the CDPH website or to the CPS website for further information. And the students are going to involve themselves, the ones that are in specific schools, of which there are 9 in the pilot. And they would access over 11,000 students in those 9 schools. So it's really, even though it's a pilot, it's kind of a large lift for some of the kids. We would be having a video where this actual mix of students would go through the whole process to show that it's not harmful, it's not a nasty thing. You can go to the dentist and still be accepted by your peers. Where they would actually start with the consent form, come to the room, get in the chair, ask questions that would seem pertinent to what other students ask, like, are you going to pull out my teeth? Are you going to give me shots? And the answer is going to be no, no, no. And they will actually work with one of the dental teams, have an actual setup unit so they can see what it's going to look like. And then the video is going to be made available to multiple venues. At some point in time, we're also going to try a microsite endeavor, and not being a really high-techy person, I'm not real sure how all that's going to fly, but that's on the agenda. So our biggest point is that we want to try to re-engage high school students because they have to be one of the hardest populations to bring into the fold of dentistry, and this is going to be our shot at it. So by this time next year, hopefully we'll have some information on how well this worked, and that could be another presentation. So I believe I have run out of slides. And is there any other slides on there? Nope, just our contact information. If you have questions, please feel free to call us, email us. We're more than willing to talk. And I would like to thank the SchoolBased Health Alliance for the opportunity to provide this information about our program. All 3 of us are very proud of what we're doing, and we hope to, if not provide information to others to this consortium, also learn to do more for ourselves. So thank you for the opportunity and for the time today.
Thank you, Mary Pat, Kim, and Catherine for that presentation. We know it's really hard to have such a large scope of schools to reach, and also teenagers, but you got to shoot your shot. But while we give everyone an opportunity to enter their questions into the Q&A box, we have a few announcements. So take it away, Tammy.
Thank you, Nataki. And let me tell you, when I hear these people speak, I am inspired, and thank you so much for doing that today, because I heard about your dedication, about the fun you have. You're just creative, and you're making a difference. So I really appreciate you taking the time to do this today. So if you are interested in the SchoolBased Health Alliance, we are an organization, as Nataki said, that works at the intersection of health and education. And if you would like to join us in this effort, we would invite you to become a member. And to find out more about our membership, you can go to our website. It's sort of cut off on my screen anyway, but it's www.sbh4all.org and look for membership. Next slide. I'm going to leave some time for questions at the end. So this is a reminder to the field, of which you may or may not be part of, but right now we are doing our census. Every year every 3 years we collect information, all things school-based health care, and that does include oral health care. So we have a census going on, and we are particularly interested in oral health services and the oral health mobile dental vans. So if you're not aware of our census going on and you would like to learn more about it, please go to our website and or give me a call, and we can make sure that you're being counted and taken care of. We also have our abstract open right now, submission for our abstracts, because our convention is coming in June of 2018. And we do have great sessions and network opportunities for oral health. And we hope to see you there in Indianapolis, June 24th through the 27th. And that is all I have to say for announcements. And let's take a look at the questions, Nataki.
Great, thank you, Tammy. So now a few questions for our presenters. And if you haven't gotten a chance to put in your questions, you can do so now. And if not, always feel free to email the presenters. So the first question, do you have a problem reaching the parents by phone due to numbers changing or phones being disconnected?
This is Kim. Yes, our case managers have a problem with that. A lot of times parents will use a phone for a certain amount of time and then disregard it and get new phones. We deal with a lot of going to the schools, meeting with the parents at the schools, working with emails, trying to get through to them any way we can. But yes, that is a huge problem.
And I would say, yes, I would echo that. Even within Chicago Public Schools, we don't have accurate records of phone numbers. So they don't even, some parents change numbers very frequently, and then they don't update at the school level either. So.
Okay, thank you. So our next question, we have seen a decrease in student participation for our schools that have transitioned to electronic registration at the beginning of the school year. Have any others seen the same result or have a suggestion on how to bridge that gap?
Hello. So for electronic records, we haven't had that problem yet. We have a health packet that goes home in the beginning of the year, and maybe Catherine or Mary Pat could speak to this more, where the consents are all sent home at once. And then when we do the oral health education, we blanket schools again with more consents.
Right. So the package, I imagine, is much like what you're experiencing with the registration at the beginning of the school year. And it tends to be a bit overwhelming for parents because in our health packet, it's not only oral health, but it's vision. And then there's some other information, student medical information and those kind of things. So we have not figured it out yet. This is our second year doing the health packet, and it has not been very kind to dental. And like Kimberly said, we do blanket the school again with consent forms. So unfortunately, we are still in the midst of it. We have not figured out how to correct the problem yet.
This is Mary Pat. One of the things that we have on our consent form, there's a medical history. If we didn't have the medical history, we would probably be able to go into an electronic form, but we can't figure out a way to make it HIPAA compliant. And our doctors will not even venture into the concept of, looking at a child's mouth without some type of medical history. So until that gets fixed somehow, or there's a better way to do that, we end up having to stick with paper. And then because you have paper, the consent return is not what we would like it to be. So it's all about HIPAA and, for us, the availability of having the student health check boxes on the consent itself. That's what caused our trouble.
Thank you. So if there aren't any more questions, we do have one more question for George, maybe George, or for both of y'all. How do you both engage the students and get them interested or solicit their help with the students?
I missed the first part of that. Nataki, can you repeat that for me?
Sure. How do you engage those students, ambassadors, or those students who are there to help?
The guidance counselors and the school nurses at the high school have constant contact with a lot of those children. So we started thinking that we would use student leaders because those are the children that are usually involved, whether it's yearbook, whether it's, whatever activity that's going on at the school. So we figured if we got some children that were doing maybe State Club, National Honor Society, some leaders in the school, that would prompt other children, totally from the school nurse and the guidance counselor's perspective, who would be a leader that would be willing to come. We actually started this project at the end of last school year, and it didn't quite get off the ground, but we found 9 students very easily just through people that the guidance counselor and the nurse picked out. And we just didn't have the time to finish that project, so that's one of our big projects at school. But it's not hard to find kids that are willing to participate. We did not find that to be an issue.
Great, thank you.
Uh-huh.
So now to our attendees, we have a few questions for you. To help us complete our poll so we can better suit your needs. So you should see on your screen some poll questions. So the first, did this presentation meet your needs? You can answer no. It did not meet the stated objectives. Somewhat met the stated objectives. Mostly met the stated objectives, and met all of the objectives. And then the second question, how well did the presentation meet the stated objectives? I guess that is the same one, and you can choose either or. For the third question, how likely are you to apply information from the presentation in your organization? Not at all likely, unlikely, likely, extremely likely. And would you recommend this webinar to others? Yes or no? Okay, great. Thank you all again so much for joining us today. And if you have any other questions or additional comments, please feel free to email us at the email you see on the screen, or to email our presenters. And we look forward to sharing this webinar with you all. Thank you and have a great day.